Question 1. Compliance review shows that a certified therapeutic musician, CTM, is working with a patient who has a complex chronic illness and is undergoing a multifaceted treatment plan involving medication, physical therapy, and psychological counseling. The CTM believes that specific therapeutic music interventions could significantly enhance the patient's pain management and emotional well-being, complementing the existing care. What is the most appropriate and compliant course of action for the CTM to integrate these proposed music interventions into the patient's holistic care plan? Option A. Add the therapeutic music interventions to the patient's care plan as a supplementary activity without seeking explicit approval from the physician, assuming it will not interfere with existing treatments. Option B. Inform the patient that therapeutic music can be a standalone treatment and proceed with the interventions independently, assuming it will be beneficial without further medical consultation. Option C. Immediately begin implementing the proposed therapeutic music interventions, as the CTM has the expertise to determine the most beneficial musical approaches for the patient's condition. Option D. Consult with the patient's primary care physician and the interdisciplinary healthcare team to discuss the proposed therapeutic music interventions, seek their input and approval, and ensure the integration aligns with the patient's overall treatment goals and medical record. Correct answer is D. Consult with the patient's primary care physician and the interdisciplinary healthcare team to discuss the proposed therapeutic music interventions, seek their input and approval, and ensure the integration aligns with the patient's overall treatment goals and medical record. Explanation: this scenario is professionally challenging because it requires a certified therapeutic musician, CTM, to navigate the complex interplay between their specialized musical interventions and the broader, established medical and psychosocial care plan for a patient. The CTM must ensure their proposed integration of therapeutic music is not only clinically relevant and beneficial, but also aligns with the patient's overall treatment goals, respecting the expertise of other healthcare professionals, and adhering to established ethical and regulatory standards for patient care. Careful judgment is required to balance the unique contributions of music therapy with the existing medical framework, ensuring patient safety and efficacy. The correct approach represents best professional practice because it prioritizes a collaborative and evidence-informed integration of therapeutic music. By consulting with the patient's primary care physician and the interdisciplinary team, the CTM demonstrates adherence to the principle of coordinated care, a cornerstone of holistic health care. This ensures that the therapeutic music interventions are complementary to, and not in conflict with, the existing medical and psychosocial treatments. Furthermore, seeking explicit approval from the physician and documenting the integration within the patient's official care plan aligns with regulatory requirements for patient record-keeping and professional accountability within the healthcare system. This approach upholds the CTM's role as a contributing member of the healthcare team, operating within established protocols and ethical guidelines for patient well-being. An incorrect approach that involves unilaterally implementing therapeutic music interventions without consulting the medical team represents a significant regulatory and ethical failure. It bypasses the established chain of command and disregards the physician's ultimate responsibility for the patient's medical care. This could lead to contraindications, adverse interactions with prescribed medications, or interference with other therapeutic modalities, potentially harming the patient. Ethically, it violates the principle of non-maleficence, do no harm, and patient autonomy, as the patient's comprehensive care plan has not been considered holistically. Another incorrect approach, which is to assume that therapeutic music is universally beneficial and can be added without specific consideration for the individual patient's condition and existing treatment, also constitutes a regulatory and ethical failure. Therapeutic music, while potent, is not a panacea and must be tailored to the specific needs and context of each patient. Failing to do so can lead to ineffective interventions or even exacerbate existing conditions, violating the principle of beneficence, acting in the patient's best interest. It also demonstrates a lack of professional due diligence and adherence to best practices in therapeutic modalities. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the patient's comprehensive care plan. Thoroughly review the patient's existing medical, psychological, and social care plan. 2. Identify potential benefits and risks. Assess how therapeutic music can specifically address the patient's needs and goals, while also considering any potential risks or contraindications in the context of their current treatment. 3. Collaborate with the interdisciplinary team. Engage in open communication with the patient's physician and other healthcare providers to discuss proposed interventions, seek their input, and ensure alignment with the overall care strategy. 4. Obtain necessary approvals. Secure formal approval from the physician or designated healthcare authority before implementing any new therapeutic interventions. 5. Document interventions. Meticulously document all proposed and implemented therapeutic music interventions, including rationale, patient response, and any consultations, within the patient's official medical record. 6. Adhere to ethical and regulatory standards. Continuously ensure all actions comply with the CTM's professional code of ethics and relevant healthcare regulations. Question 2. Operational review demonstrates that a certified therapeutic musician, CTM, is developing a music intervention plan for a client experiencing chronic pain and anxiety. The CTM has identified several musical selections known to influence the autonomic nervous system and neurotransmitter release. Which of the following approaches best reflects a proactive risk assessment of the impact of music on the client's nervous system? Option A. Focus exclusively on musical genres that are known to be universally relaxing, disregarding individual client feedback or potential physiological sensitivities to certain frequencies or rhythms. Option B. Prioritize musical selections that have robust scientific evidence demonstrating their ability to modulate the sympathetic and parasympathetic nervous systems, while also considering the client's reported preferences and any known contraindications for specific auditory stimuli. Option C. Select music based primarily on the CTM's personal experience and intuition regarding which pieces are most likely to evoke a calming effect, without extensive review of neurophysiological research. Option D. Implement a broad range of musical interventions without a specific focus on their documented neurophysiological effects, assuming that any music will have a generally positive impact on the nervous system. The correct answer is B. Prioritize musical selections that have robust scientific evidence demonstrating their ability to modulate the sympathetic and parasympathetic nervous systems, while also considering the client's reported preferences and any known contraindications for specific auditory stimuli. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified therapeutic musician, CTM, to interpret complex physiological responses to music within a therapeutic context, balancing client well-being with the need for evidence-based practice. The CTM must consider the potential for both positive and negative impacts on the nervous system, necessitating a nuanced understanding of neurobiology and individual client variability. The challenge lies in moving beyond anecdotal evidence to a more systematic risk assessment that aligns with professional standards and client safety. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-informed risk assessment. This aligns with the CTM's ethical obligation to provide safe and effective care. By considering the known neurophysiological effects of music, e.g., modulation of the autonomic nervous system, release of neurotransmitters like dopamine and endorphins, and impact on brainwave activity, CTM can proactively identify potential risks and implement appropriate mitigation strategies. This approach is grounded in the principle of do no harm, and ensures that therapeutic interventions are tailored to the individual client's needs and sensitivities, thereby maximizing therapeutic benefit while minimizing adverse effects. This aligns with the core tenets of therapeutic practice, which demand a thorough understanding of the tools and their potential impacts. Incorrect approach is analysis. One incorrect approach fails to acknowledge the direct neurophysiological pathways through which music influences the nervous system. It may rely solely on subjective client reports, without considering objective physiological markers or established scientific understanding of music's impact on the brain and body. This oversight can lead to misinterpretations of client responses and potentially inappropriate or ineffective intervention, violating the professional standard of care by not leveraging available scientific knowledge. Another incorrect approach might overemphasize the potential for negative physiological responses without a balanced consideration of the well-documented positive effects. This could lead to an overly cautious or restrictive approach, limiting the therapeutic potential of music. Ethically, This approach could be seen as failing to provide the full spectrum of beneficial interventions available, potentially hindering client progress due to an unwarranted focus on risk. A third incorrect approach might involve applying generalized protocols without considering individual client variability in neurological and psychological responses to music. The nervous system's reaction to auditory stimuli is highly personalized, influenced by factors such as past experiences, current emotional state, and underlying health conditions. A one-size-fits-all strategy neglects this crucial aspect, risking adverse reactions or a lack of efficacy, thereby failing to meet the professional obligation of individualized care. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough understanding of the scientific literature regarding music's impact on the nervous system. This knowledge should then be integrated with a comprehensive client assessment, including their medical history, current condition, and personal preferences. A risk assessment framework should be employed, identifying potential benefits and harms, and developing strategies to maximize benefits while mitigating risks. Ongoing monitoring of client responses, both subjective and objective, is crucial for adapting the therapeutic approach as needed. This iterative process ensures that interventions remain safe, effective, and client-centered, adhering to the highest professional and ethical standards. Question 3. Which approach would be most aligned with the principles of neuroplasticity and neurotransmitter modulation when designing a therapeutic music intervention for a client experiencing cognitive decline, ensuring adherence to best practices in therapeutic musicianship? Option A. Developing a personalized music engagement plan that incorporates the client's preferred musical genres and active participation, alongside passive listening, to stimulate diverse neural networks and encourage endogenous neurotransmitter activity. Option B. Recommending specific classical music compositions believed to have a direct impact on dopamine and serotonin levels, without prior assessment of the client's musical preferences or current cognitive state. Option C. Implementing a structured music listening program featuring pieces known to evoke strong emotional responses, with the expectation of significant neurotransmitter release and enhanced neural pathway formation. Option D. Focusing solely on rhythmic entrainment exercises using percussive instruments, assuming this will universally promote neuroplasticity by regulating brainwave frequencies. The correct answer is C. Implementing a structured music listening program featuring pieces known to evoke strong emotional responses, with the expectation of significant neurotransmitter release and enhanced neural pathway formation. Explanation. This scenario is professionally challenging because it requires a certified therapeutic musician, CTM, to apply their understanding of neuroplasticity and neurotransmitters in a practical, client-centered manner, while adhering strictly to the ethical and regulatory guidelines governing their practice within the specified jurisdiction. The CTM must balance the potential benefits of music interventions with the need for evidence-based practice and client safety, ensuring that their recommendations are aligned with established professional standards and do not overstep the boundaries of their scope of practice. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the client's needs and current neurological state, integrating this with established scientific understanding of music's impact on neuroplasticity and neurotransmitter release. This approach is ethically sound and professionally responsible, as it ensures interventions are tailored, evidence-informed, and delivered within the CTM's competency. It aligns with the core principles of therapeutic musicianship, emphasizing client well-being and the responsible application of musical interventions based on a deep understanding of their physiological and psychological effects, as implicitly guided by the CTM certification standards, which would necessitate such a rigorous, client-focused methodology. Incorrect approaches fail due to several regulatory and ethical shortcomings. One approach might involve making broad, unsubstantiated claims about music's ability to cure neurological conditions or significantly alter neurotransmitter levels without sufficient empirical support or individual assessment. This is ethically problematic as it could lead to false expectations and potentially deter clients from seeking conventional medical treatment, violating principles of informed consent and non-maleficence. Another incorrect approach might be to apply a standardized, one-size-fits-all musical protocol to all clients experiencing similar neurological challenges, disregarding individual differences in response, musical preferences, and specific neurological deficits. This fails to uphold the principle of individualized care and can be ineffective or even detrimental, representing a failure to adhere to best practices in therapeutic intervention. A third incorrect approach could involve recommending specific musical pieces or genres solely based on anecdotal evidence or personal preference, without considering the client's receptivity or the potential for the music to induce unintended physiological or emotional responses. This demonstrates a lack of professional rigor and a disregard for the client's unique experience, potentially leading to adverse outcomes and a breach of professional duty of care. Professional decision-making in similar situations requires a systematic process. First, conduct a thorough client assessment, gathering information about their specific neurological condition, current symptoms, medical history, and personal preferences. Second, consult current, evidence-based research on music's effects on neuroplasticity and neurotransmitters relevant to the client's condition. Third, develop a personalized intervention plan that is tailored to the client's needs and goals, considering potential benefits and risks. Fourth, continuously monitor the client's response to the intervention, making adjustments as necessary and documenting all progress and observations. Finally, maintain professional boundaries, collaborate with other healthcare professionals when appropriate, and adhere to all relevant ethical codes and regulatory guidelines. Question 4. The review process indicates a certified therapeutic musician, CTM, is preparing to work with a new client experiencing significant anxiety. The CTM is considering using improvisational techniques to help the client explore and express emotions. Which of the following approaches best demonstrates a responsible risk assessment for this scenario? Option A. Immediately engage in free-form, highly dynamic improvisation to encourage the client to release pent-up emotions. Option B. Improvise in a complex dissonant style to challenge the client's comfort zone and promote emotional catharsis. Option C. Avoid all improvisational techniques due to the client's high anxiety, sticking only to pre-selected, familiar repertoire. Option D. Begin improvising with a calm, predictable musical structure, observing the client's reactions closely, and being prepared to shift tempo, key, or style based on their cues. The correct answer is D. Begin improvising with a calm, predictable musical structure, observing the client's reactions closely, and being prepared to shift tempo, key, or style based on their cues. Explanation. The review process indicates a need to assess the certified therapeutic musician's, CTM, understanding of improvisation techniques within therapeutic settings, specifically focusing on risk assessment. This scenario is professionally challenging because improvisation, by its nature, involves spontaneous creation and adaptation, which can introduce unforeseen risks if not managed thoughtfully. A CTM must balance the creative freedom of improvisation with the client's safety, well-being, and therapeutic goals. Careful judgment is required to ensure that improvisational choices enhance the therapeutic experience without causing distress or exacerbating a client's condition. The correct approach represents best professional practice because it prioritizes a proactive and client-centered risk assessment before engaging in improvisational techniques. This aligns with the core ethical principles of do no harm and acting in the best interest of the client, which are foundational to therapeutic practice. By considering the client's current state, potential triggers, and the specific therapeutic goals, the CTM can make informed decisions about the appropriateness and direction of improvisation. This approach ensures that the improvisational elements are tailored to the client's needs and capacity, thereby maximizing therapeutic benefit while minimizing potential harm. Regulatory frameworks for therapeutic musicians emphasize client safety and the need for practitioners to operate within their scope of competence, which includes assessing and managing risks associated with therapeutic intervention. Incorrect approaches fail to adequately address the inherent risks of improvisation in a therapeutic context. One incorrect approach might involve improvising freely without any prior assessment of the client's current emotional or psychological state. This disregards the potential for spontaneous musical interactions to evoke unexpected or overwhelming emotional responses, which could be detrimental to the client's well-being. This failure constitutes a breach of the ethical duty to protect the client from harm. Another incorrect approach could be to avoid improvisation altogether due to perceived risk, thereby limiting the potential therapeutic benefits that tailored improvisational techniques can offer. While caution is necessary, complete avoidance without considering the client's specific needs and potential for positive engagement through improvisation may not always be in the client's best interest and could be seen as a failure to utilize a valuable therapeutic tool appropriately. A third incorrect approach might involve improvising in a style or tempo that is not congruent with the client's known preferences or current needs, without any attempt to gauge their reaction or adapt. This demonstrates a lack of client-centeredness and a failure to respond therapeutically to the client's cues, potentially leading to discomfort or disengagement. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough client assessment. Understand the client's history, current condition, preferences, and therapeutic goals. 2. Risk identification. Anticipate potential risks associated with specific improvisational techniques, considering the client's vulnerabilities. 3. Mitigation strategies. Develop plans to manage identified risks, such as having predetermined musical anchors or knowing when to transition away from improvisation. 4. Client-led adaptation. Continuously observe and respond to the client's verbal and nonverbal cues during the improvisational process. 5. Ethical reflection. Regularly evaluate the effectiveness and safety of improvisational interventions. Question 5. The analysis reveals that a certified therapeutic musician, CTM, is working with a patient who has expressed a strong aversion to a particular musical style that the CTM believes would be highly beneficial for the patient's current state of agitation. The patient has clearly stated, "I cannot listen to that music. It makes me feel worse." How should the CTM proceed in accordance with CTM regulatory framework and therapeutic music principles? Option A. Respect the patient's stated preference and explore alternative musical selections or supportive non-musical presence that aligns with the patient's comfort and expressed needs. Option B. Play the music at a lower volume, hoping the patient will eventually become accustomed to it and realize its benefits. Without further direct discussion about their aversion, Option C. Immediately cease all therapeutic music interventions and inform the patient's primary caregiver that the patient is being difficult and uncooperative with recommended therapies. Option D. Proceed with the chosen musical style, explaining to the patient that it is for their own good and that they may not fully understand its therapeutic benefits. The correct answer is A. Respect the patient's stated preference and explore alternative musical selections or supportive non-musical presence that aligns with the patient's comfort and expressed needs. Explanation. The analysis reveals a scenario where a certified therapeutic musician, CTM, must navigate the ethical and regulatory landscape concerning patient autonomy and the scope of therapeutic music interventions. The challenge lies in balancing the musician's professional judgment and understanding of therapeutic music principles with the expressed wishes and perceived needs of the patient, all within the established CTM regulatory framework. The correct approach prioritizes patient autonomy and informed consent, aligning with the core ethical principles of therapeutic practice and the regulatory guidelines for CTMs. This approach recognizes that while the CTM possesses expertise in therapeutic music, the ultimate decision-making authority regarding their care rests with the patient. By engaging in open communication, explaining the rationale behind proposed interventions, and respecting the patient's refusal, the CTM upholds professional integrity and adheres to regulations that mandate patient-centered care and respect for individual choice. This demonstrates a commitment to ethical practice by avoiding coercion and ensuring that interventions are collaborative and aligned with the patient's values and preferences. An incorrect approach that proceeds with an intervention against the patient's expressed wishes, even with the belief that it is therapeutically beneficial, constitutes a significant regulatory and ethical failure. This violates the principle of patient autonomy, which is a cornerstone of healthcare practice and is implicitly or explicitly covered by CTM certification standards. Such an action could be construed as overstepping professional boundaries and engaging in unauthorized practice, as the CTM is not a medical doctor and cannot unilaterally dictate treatment. Furthermore, it disregards the patient's right to self-determination and could lead to a breakdown of trust, potentially causing distress to the patient and undermining the therapeutic relationship. Another incorrect approach that involves discussing the patient's refusal with other staff without explicit consent, unless for the purpose of seeking guidance on how to best support the patient's decision, or if there is a clear indication of harm, could also be problematic. This may breach patient confidentiality, a fundamental ethical and regulatory requirement for all healthcare professionals, including CTMs. While collaboration is encouraged, it must be done in a manner that respects patient privacy and is directly relevant to the patient's care and well-being, not as a means to override their wishes. A professional decision-making process for similar situations should begin with a thorough understanding of the patient's current state, their expressed preferences, and the rationale behind those preferences. The CTM should then clearly articulate the potential benefits of the proposed therapeutic music intervention, explaining it in a way that is understandable to the patient. If the patient maintains their refusal, the CTM must respect that decision. The focus should then shift to exploring alternative approaches that align with the patient's comfort level and preferences, or to providing supportive presence without direct musical intervention, if that is what the patient desires. Documentation of the patient's wishes and the CTM's response is also a critical step in professional practice. Question 6. The risk matrix shows that a certified therapeutic musician, CTM, is working with a client experiencing chronic pain. The CTM needs to select a musical intervention that aims to modulate the client's autonomic nervous system response, specifically targeting a reduction in sympathetic nervous system activation. Considering the comparative anatomy and physiology of the human nervous system, which of the following approaches is most likely to achieve this goal? Option A. Selecting music characterized by extreme dynamic shifts and abrupt silences to create a sense of surprise and vigilance, which is known to activate the sympathetic nervous system. Option B. Employing highly dissonant and unpredictable musical passages to stimulate a strong emotional response, which can indirectly lead to a shift in autonomic balance. Option C. Focusing on music with rapid tempo changes and complex rhythmic patterns to increase overall arousal, aiming to distract from pain signals through heightened sensory input. Option D. Utilizing music with a consistent, moderate tempo and predictable melodic structure to promote a sense of calm and predictability, thereby encouraging parasympathetic nervous system dominance. Correct answer is D. Utilizing music with a consistent, moderate tempo and predictable melodic structure to promote a sense of calm and predictability, thereby encouraging parasympathetic nervous system dominance. Explanation. The scenario presents a challenge for a certified therapeutic musician, CTM, due to the inherent variability in human anatomy and physiology, even within a specific population group. CTM must understand that conditions affecting one individual's physiological response to music may differ significantly from another's, necessitating a personalized approach rather than a generalized one. This requires a deep understanding of how various anatomical systems, e.g., nervous, cardiovascular, respiratory, interact and respond to auditory and emotional stimuli, and how these responses can be modulated by therapeutic music. The correct approach represents best professional practice because it prioritizes individualized care, which is a cornerstone of ethical therapeutic practice. By considering the specific anatomical and physiological characteristics of the client, the CTM can tailor musical interventions to maximize therapeutic benefit and minimize potential adverse effects. This aligns with the CTM's responsibility to provide safe and effective care, respecting the unique biological makeup of each individual. Regulatory frameworks for therapeutic professions often emphasize patient-centered care and evidence-based practice, both of which are supported by a thorough understanding of human anatomy and physiology applied to the individual. Incorrect approaches fail to meet professional standards by oversimplifying complex biological interactions, or by relying on assumptions that may not hold true for every client. A generalized approach, for instance, risks overlooking critical individual differences that could lead to ineffective or even harmful interventions. This demonstrates a failure to apply a nuanced understanding of anatomy and physiology, potentially violating ethical duties of care and regulatory requirements for competent practice. Relying solely on anecdotal evidence or popular trends without grounding in physiological principles ignores the scientific basis of therapeutic music and can lead to misapplication of techniques, potentially causing distress or exacerbating existing conditions. This constitutes a failure to adhere to professional standards of practice and may contravene regulations requiring evidence-informed interventions. The professional decision-making process for similar situations involves a systematic assessment of the client's current physiological state, medical history, and any known anatomical variations or conditions. This assessment should inform the selection and adaptation of musical interventions. Professionals should continuously monitor the client's response and be prepared to adjust their approach based on real-time physiological and psychological feedback, always grounding their decisions in a solid understanding of human anatomy and physiology. Question 7. Market research demonstrates a growing interest among clients in therapeutic music interventions, incorporating biofeedback mechanisms to enhance relaxation responses. A CTM has encountered a preliminary study suggesting a novel application of specific rhythmic patterns synchronized with heart rate variability, HRV, to deepen meditative states. The CTM is considering integrating this novel rhythmic approach into their practice for clients experiencing anxiety. Which of the following represents the most ethically sound and professionally responsible approach for the CTM? Option A. Dismiss the preliminary study due to its early stage, continuing to exclusively use established, traditional therapeutic music techniques without exploring any new research. Option B. Conduct a thorough review of existing literature on HRV and therapeutic music, seeking out peer-reviewed studies, meta-analyses, and systematic reviews that validate the efficacy and safety of such synchronized rhythmic interventions before considering its integration. Option C. Rely on anecdotal reports from other practitioners who have experimented with similar techniques, as this provides practical insights into real-world application. Option D. Immediately incorporate the novel rhythmic patterns into client sessions, as the preliminary study indicates potential benefits and client interest is high. The correct answer is D. Immediately incorporate the novel rhythmic patterns into client sessions, as the preliminary study indicates potential benefits and client interest is high. Explanation. This scenario presents a professional challenge because it requires a certified therapeutic musician, CTM, to balance the desire to incorporate emerging research with the imperative to adhere to established, evidence-based practices. CTM must critically evaluate the quality and applicability of new findings before integrating them into client care, ensuring that interventions are not only novel, but also demonstrably effective and safe, aligning with the core principles of therapeutic musicianship. The correct approach represents best professional practice because it prioritizes client well-being and ethical responsibility by grounding interventions in robust, peer-reviewed evidence. This aligns with the CTM's commitment to providing high-quality, effective care. Adhering to established evidence-based practices ensures that interventions have a proven track record of positive outcomes and minimizes the risk of employing unproven or potentially harmful techniques. This approach upholds the professional standards and ethical guidelines expected of a CTM, which emphasize the use of validated therapeutic modalities. An incorrect approach that relies solely on anecdotal evidence or preliminary findings without critical evaluation fails to meet the standards of evidence-based practice. This can lead to the implementation of interventions that are not effective, potentially wasting client resources and time, or worse, causing unintended negative consequences. Such an approach would be ethically questionable as it deviates from the professional obligation to provide care based on the best available scientific understanding. Another incorrect approach, which dismisses all new research without proper consideration, is also professionally limiting. While caution is necessary, a complete disregard for emerging evidence can hinder the evolution of therapeutic music practices and prevent the adoption of potentially beneficial new techniques that have undergone rigorous validation. This can be seen as a failure to engage in continuous professional development and to critically assess advancements within the field. Professionals should employ a decision-making framework that involves a systematic review of available research. This includes evaluating the methodology, sample size, and statistical significance of studies. When considering new interventions, a CTM should seek out meta-analyses, systematic reviews, and randomized controlled trials. If preliminary research shows promise, it should be approached with caution, perhaps as an adjunct to established practices, until further robust evidence emerges. The decision to adopt any new practice should be informed by a thorough understanding of its efficacy, safety, and ethical implications, always prioritizing the client's best interests and established professional standards. Question 8. During the evaluation of a client's response to a therapeutic music session, a certified therapeutic musician, CTM, observes a slight decrease in the client's heart rate and a reported feeling of relaxation. According to the regulatory framework for CTMs, which of the following actions best reflects appropriate professional practice? Option A. Documenting the observed physiological changes and the client's subjective report of relaxation, noting the music's potential contribution to the client's comfort and well-being, and sharing this information with the client's healthcare team. Option B. Interpreting the decrease in heart rate as a direct indicator of reduced stress hormone levels and informing the client that the music has medically proven to mitigate their physiological stress response. Option C. Focusing solely on the objective decrease in heart rate as the primary measure of the session's success, without considering the client's subjective experience or consulting with other healthcare professionals. Option D. Concluding that the therapeutic music intervention has successfully lowered the client's blood pressure and recommending a specific music protocol to manage their hypertension. The correct answer is A. Documenting the observed physiological changes and the client's subjective report of relaxation, noting the music's potential contribution to the client's comfort and well-being, and sharing this information with the client's healthcare team. Explanation. The scenario presents a common challenge for certified therapeutic musicians, CTM, where objective physiological data must be interpreted within the context of a client's subjective experience and the ethical imperative to avoid making unsubstantiated medical claims. The core professional challenge lies in bridging the gap between observable physiological changes and the therapeutic goals of music intervention, while strictly adhering to the CTM scope of practice as defined by the relevant regulatory framework. The correct approach represents best professional practice because it prioritizes client-centered care and adheres to the established scope of practice for a CTM. By focusing on observable musical engagement and the client's reported experience, it avoids overstepping into medical diagnosis or treatment, which is outside the CTM's purview. This approach aligns with the ethical guidelines that mandate CTMs to work collaboratively with healthcare professionals and to base their interventions on established therapeutic music principles, not on interpreting raw physiological data as definitive medical outcomes. The regulatory framework for CTMs emphasizes the use of music to support well-being and comfort, not to directly manage or treat specific physiological conditions. Incorrect approaches fail because they either misinterpret the CTM's role by attempting to diagnose or prescribe based on physiological data, or they neglect the crucial element of client experience, attempting to directly link specific heart rate or blood pressure changes to a successful music intervention without considering the client's subjective response or a healthcare professional's assessment is a regulatory and ethical misstep. It implies a level of medical expertise and diagnostic capability that a CTM does not possess. Similarly, focusing solely on physiological data without acknowledging the client's reported feelings or comfort level ignores the holistic nature of therapeutic music and can lead to interventions that are not truly beneficial or appropriate for the individual. These approaches risk violating regulations that prohibit CTMs from practicing medicine or providing medical advice. The professional decision-making process for similar situations should involve a clear understanding of the CTM scope of practice, a commitment to client-centered care, and a collaborative approach with other healthcare providers. When presented with physiological data, a CTM should consider it as one piece of information within a broader context, always prioritizing the client's subjective experience and comfort. The primary focus should remain on the therapeutic use of music to support emotional, cognitive, and social well-being, rather than on interpreting or acting upon physiological data as if it were a medical diagnosis or treatment outcome. This involves asking, how is the music impacting the client's overall experience and comfort, and how can I best support their well-being through musical engagement in collaboration with their healthcare team? Question 9. Compliance review shows a certified therapeutic musician, CTM, is working with a client experiencing significant anxiety. The CTM is considering their musical approach. Which of the following best reflects a theoretically sound and therapeutically appropriate strategy for selecting musical elements? Option A. Select a minor scale that evokes a sense of melancholy and use dissonant chords to mirror the client's internal turmoil. Option B. Perform a technically demanding classical piece that requires focused listening, regardless of the client's current state of receptiveness. Option C. Choose a major scale known for its calming properties, construct simple, consonant chords, and employ a slow, steady rhythm. Option D. Improvise freely with complex harmonic progressions and unpredictable rhythmic shifts to explore the client's emotional landscape. The correct answer is C. Choose a major scale known for its calming properties, construct simple, consonant chords, and employ a slow, steady rhythm. Explanation: this scenario is professionally challenging because it requires a certified therapeutic musician, CTM, to balance the immediate therapeutic needs of a client with the foundational principles of music theory, all while adhering to professional standards and ethical guidelines. The CTM must demonstrate a nuanced understanding of how musical elements can impact a client's well-being, moving beyond simply playing pleasant sounds. The challenge lies in selecting musical elements that are not only aesthetically pleasing, but also theoretically sound and therapeutically appropriate for the client's specific condition and receptiveness. The correct approach represents best professional practice because it prioritizes the client's individualized needs and therapeutic goals, informed by a solid understanding of music theory. By selecting a scale that is known to evoke a sense of calm and stability, and by constructing chords that are harmonically consonant and rhythmically simple, the CTM is creating a musical environment that is both supportive and conducive to the client's therapeutic journey. This aligns with the core principles of therapeutic musicianship, which emphasize the intentional use of music to promote healing and well-being, grounded in a professional understanding of musical structure and its psychological effects. This approach demonstrates a commitment to evidence-informed practice and client-centered care, which are paramount in the field. An incorrect approach that involves improvising freely without regard for established musical structures or the client's known sensitivities would be professionally unacceptable. This is because it risks introducing dissonance, unpredictable rhythmic patterns, or scales that might inadvertently trigger anxiety or discomfort in the client. Such an approach fails to demonstrate the professional competence expected of a CTM, potentially violating ethical guidelines that mandate the provision of safe and effective therapeutic interventions. It suggests a lack of understanding of how musical elements can be intentionally manipulated for therapeutic benefit, instead relying on chance or personal preference, which is not a sound basis for therapeutic practice. Another incorrect approach, such as rigidly adhering to a complex musical composition that is beyond the client's current capacity to process or engage with, would also be problematic. While the composition might be theoretically sound, its complexity could overwhelm the client, hindering rather than facilitating the therapeutic process. This demonstrates a failure to adapt musical interventions to the client's immediate state and needs, which is a critical aspect of therapeutic musicianship. It prioritizes musical performance over therapeutic outcome, a clear ethical and professional misstep. The professional decision-making process for similar situations should involve a thorough assessment of the client's current state, their therapeutic goals, and any known preferences or sensitivities. This assessment should then be integrated with the CTM's knowledge of music theory, specifically scales, chords, and rhythm, to select musical elements that are most likely to support the therapeutic objectives. The CTM should be prepared to adapt their approach in real time, observing the client's responses and making adjustments as needed. This iterative process of assessment, intervention, and adaptation, guided by both theoretical knowledge and client feedback, is the hallmark of effective therapeutic musicianship. Question 10. The monitoring system demonstrates that a certified therapeutic musician, CTM, is engaging in activities that involve playing music for groups in a healthcare setting. Which of the following best defines the scope of therapeutic music in this context according to CTM regulations? Option A. The provision of music for general enjoyment and relaxation, aiming to create a pleasant atmosphere for individuals in the healthcare setting. Option B. The intentional application of music to address specific client needs and goals, facilitated through a structured process of assessment, planning, intervention, and evaluation. Option C. The performance of popular music selections that are known to evoke positive emotional responses in a broad audience. Option D. The use of improvisational music techniques based on the musician's personal interpretation of the ambient mood. The correct answer is B. The intentional application of music to address specific client needs and goals, facilitated through a structured process of assessment, planning, intervention, and evaluation. Explanation. This scenario presents a challenge in defining the boundaries of therapeutic music within the Certified Therapeutic Musician, CTM, framework. The core difficulty lies in distinguishing between music used for general well-being or entertainment and music specifically applied with therapeutic intent, guided by established principles and client-centered goals. Careful judgment is required to ensure that the musician's practice aligns with the CTM scope and ethical obligations. The correct approach represents best professional practice because it emphasizes the intentional application of music to address specific client needs and goals, as outlined by the CTM regulatory framework. This involves a process of assessment, planning, intervention, and evaluation, all grounded in the understanding that therapeutic music is a deliberate modality aimed at facilitating health and well-being. This aligns with the ethical imperative to provide services that are evidence-informed and client-focused, ensuring that interventions are appropriate and effective within the defined scope of practice. An incorrect approach that focuses solely on the aesthetic qualities of music or its general mood-altering effects fails to meet the regulatory requirements for therapeutic music. This is because it neglects the essential element of intentionality and the structured application of musical elements to achieve specific, measurable outcomes. Such an approach risks misrepresenting services as therapeutic when they are, in fact, recreational or entertainment-based, potentially leading to client misunderstanding and unmet therapeutic needs. This constitutes an ethical failure by not adhering to the defined scope of practice and a regulatory failure by not operating within the established guidelines for therapeutic music provision. Another incorrect approach that relies on anecdotal evidence or personal intuition without a systematic framework for assessment and goal setting also falls short. While intuition can play a role, it must be guided by established therapeutic principles and client data. Without a structured approach, the interventions may lack efficacy, consistency, and accountability, failing to meet the professional standards expected of a CTM. This represents a failure to adhere to best practices in client care and a potential violation of regulatory expectations for evidence-informed practice. The professional decision-making process for similar situations should involve a clear understanding of the CTM's defined scope of practice, including the principles and methodologies of therapeutic music. Professionals must engage in a thorough client assessment to identify specific needs and goals. Interventions should be intentionally designed and implemented to address these identified needs, with a plan for monitoring progress and evaluating outcomes. This systematic, client-centered approach ensures that practice remains within the ethical and regulatory boundaries of therapeutic music. Question 11. Regulatory review indicates that certified therapeutic musicians, CTM, are expected to maintain comprehensive and accurate client records. Following a therapeutic music session with a client experiencing acute anxiety, a CTM is faced with an immediate request to begin another session with a different client. What is the most appropriate course of action regarding documentation for the first client? Option A. Briefly note the client's primary concern and the intervention used, then proceed to the next client, planning to complete the full documentation later in the day. Option B. Omit detailed subjective observations from the first client's note, focusing only on the musical activities performed to save time before the next session. Option C. Delegate the documentation of the first client's session to a colleague who is not directly involved in the therapeutic music practice. Option D. Immediately complete a detailed note for the first client, including subjective observations, objective responses, and the rationale for interventions, before commencing the next session. Correct answer is A. Briefly note the client's primary concern and the intervention used, then proceed to the next client, planning to complete the full documentation later in the day. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic music practice, where a musician must balance the immediate needs of a client with the long-term requirements for professional accountability and continuity of care. The pressure to provide immediate support can sometimes overshadow the meticulous nature of documentation, leading to potential gaps in the client's record. This requires careful judgment to ensure that both immediate therapeutic intervention and essential administrative tasks are addressed effectively. Correct approach analysis. The correct approach prioritizes immediate client care while ensuring that essential documentation is completed promptly and accurately. This aligns with the ethical imperative to provide competent and compassionate care, as well as regulatory requirements for maintaining accurate client records. Prompt documentation ensures that the therapeutic process is traceable, facilitates communication among healthcare professionals if necessary, and supports evidence-based practice. It upholds the professional standard of care by creating a reliable record of interventions and client responses, which is crucial for ongoing treatment planning and evaluation. Incorrect approaches analysis. One incorrect approach involves delaying documentation until the end of the day or week. This poses a significant risk of memory lapse, leading to incomplete or inaccurate entries. It violates the principle of timely record keeping, which is often a regulatory requirement and an ethical expectation for maintaining a clear and reliable client history. This delay can hinder effective communication and continuity of care if other professionals need access to the client's information urgently. Another incorrect approach is to omit subjective client observations and focus solely on objective musical activities. Therapeutic music is inherently subjective, and client responses, emotional states, and verbalizations are critical data points. Failing to document these aspects provides an incomplete picture of the therapeutic process and its impact, potentially misrepresenting the effectiveness of the interventions and failing to capture the full scope of the musician's role. This omission can also be seen as a failure to adhere to comprehensive documentation standards. A third incorrect approach is to use vague or generic descriptions of interventions and client responses. Therapeutic music practice requires specificity. Vague language makes it difficult to assess progress, replicate successful interventions, or understand the nuances of the client's experience. This lack of detail undermines the professional value of the documentation and can be considered a failure to meet professional standards for record keeping, potentially impacting future therapeutic decisions and professional accountability. Professional reasoning. Professionals should approach documentation by integrating it into their workflow. This means allocating dedicated time for documentation immediately following each session or at designated, frequent intervals. A structured approach, using standardized forms or templates where appropriate, can ensure all necessary components are included. Prioritizing essential information while maintaining accuracy and detail is key. Professionals should also be aware of specific institutional or regulatory requirements for documentation timelines and content. When faced with time constraints, it is crucial to document the most critical aspects of the session immediately and complete the full record as soon as feasible, rather than neglecting it entirely. Question 12. The performance metrics show a client exhibiting increased physiological signs of anxiety, such as shallow breathing and muscle tension, during a therapeutic music session. The certified therapeutic musician, CTM, has been performing a piece with a moderate tempo and complex harmonic structure. Considering the client's current state, which of the following musical adjustments would be most appropriate to promote immediate relaxation and reduce distress? Option A. Transition to a slower tempo, softer dynamics, and simpler consonant harmonic progressions. Option B. Abruptly switch to a highly energetic and rhythmically complex piece from a different genre. Option C. Continue with the current piece, increasing the volume to create a more commanding presence. Option D. Introduce more dissonant chords and rapid, unpredictable melodic shifts to encourage emotional release. The correct answer is A. Transition to a slower tempo, softer dynamics, and simpler consonant harmonic progressions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a certified therapeutic musician, CTM, to adapt their musical approach in real time based on subtle, nonverbal cues from a client experiencing significant emotional distress. The challenge lies in accurately interpreting these cues and selecting musical techniques that are both therapeutically effective and ethically sound, without causing further distress or overstepping professional boundaries. The CTM must balance their technical musical proficiency with their understanding of therapeutic principles and client well-being. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the client's immediate emotional state and safety. It involves a nuanced understanding of how specific musical elements, such as tempo, dynamics, and harmonic complexity, can directly influence mood and physiological responses. By choosing a slower tempo, softer dynamics, and simpler harmonic structures, the CTM is employing techniques known to promote relaxation, reduce anxiety, and create a sense of calm and security. This aligns with the ethical obligation of a CTM to provide care that is client-centered, non-malefic, and responsive to individual needs, as outlined in professional practice guidelines that emphasize sensitivity to client presentation. Incorrect approaches analysis. One incorrect approach might involve continuing with the originally planned repertoire without modification. This fails to acknowledge the client's distress and could be perceived as insensitive or even harmful, potentially exacerbating their anxiety. Ethically, this violates the principle of client-centered care and the duty to respond to immediate client needs. Another incorrect approach could be to abruptly change to a significantly different musical style or genre that the client has not previously responded positively to, or that is known to be stimulating. This demonstrates a lack of understanding of how musical choices impact emotional states and could be disruptive rather than therapeutic. It also risks alienating the client and failing to establish a safe therapeutic space. A further incorrect approach might involve introducing complex improvisational elements or highly dissonant harmonies in an attempt to engage the client. While improvisation can be a valuable tool, its application must be carefully considered. In this context, without a clear understanding of the client's current capacity to process such stimuli, it could be overwhelming and counterproductive, leading to increased agitation. This would represent a failure to adhere to the principle of do no harm. Professional reasoning. Professionals in this field must cultivate a strong capacity for observational assessment and adaptive intervention. The decision-making process involves continuous monitoring of the client's nonverbal cues, e.g., breathing patterns, facial expressions, body tension, correlating these with known therapeutic effects of musical elements, and making informed choices about repertoire and performance style. This requires a deep understanding of both musical theory and therapeutic application, guided by ethical principles of client welfare, competence, and professional responsibility. The ability to pivot musically based on client response is a hallmark of experienced and ethical therapeutic musicianship. Question 13. Benchmark analysis indicates that a certified therapeutic musician, CTM, is preparing to conduct an initial assessment for a new client. The CTM needs to gather information regarding the client's musical background, current emotional state, physical comfort levels, and any specific therapeutic goals they hope to achieve through music. Which of the following assessment strategies best adheres to the regulatory framework and ethical guidelines for a CTM? Option A. Focus solely on asking the client to list their top 5 favorite songs and the reasons they enjoy them, without inquiring about their current emotional or physical state. Option B. Conduct an open-ended interview to explore the client's experiences with music, their current feelings, and any physical sensations they are experiencing, followed by the administration of a brief, client-appropriate questionnaire to gather specific details on musical preferences and any known sensitivities. Option C. Administer a comprehensive, multi-page questionnaire that covers a wide range of psychological and physiological indicators, without an initial interview to save time. Option D. Engage in a brief, informal conversation about the client's favorite genres of music and ask if they have any immediate requests for songs. The correct answer is B. Conduct an open-ended interview to explore the client's experiences with music, their current feelings, and any physical sensations they are experiencing, followed by the administration of a brief, client-appropriate questionnaire to gather specific details on musical preferences and any known sensitivities. Explanation. This scenario presents a professional challenge due to the inherent variability in client responses and the need to gather comprehensive, accurate information for effective therapeutic music intervention. A certified therapeutic musician, CTM, must navigate subjective client experiences with objective assessment techniques, ensuring client comfort and confidentiality while adhering to professional standards. Careful judgment is required to select and apply assessment methods that are both ethically sound and clinically relevant. The correct approach represents best professional practice because it prioritizes a multimodal assessment strategy that integrates direct client interaction with structured data collection. This aligns with the ethical imperative to provide individualized care, respecting client autonomy and dignity. By using a combination of open-ended interview questions and a standardized questionnaire, the CTM can triangulate information, gain deeper insights into the client's emotional, cognitive, and physical state, and identify specific musical preferences and contraindications. This comprehensive understanding is crucial for developing a safe and effective therapeutic music plan, as mandated by professional guidelines that emphasize thorough client assessment prior to intervention. An incorrect approach that relies solely on a brief, informal chat fails to meet the professional obligation for a thorough assessment. This oversight could lead to misinterpretations of the client's needs, potentially resulting in inappropriate musical selections that could be ineffective or even detrimental. Ethically, this approach breaches the duty of care by not gathering sufficient information to ensure client well-being. Another incorrect approach that involves administering a lengthy, complex questionnaire without prior rapport building or explanation is also professionally unacceptable. This can overwhelm the client, leading to inaccurate or incomplete responses, and may violate principles of client respect and informed consent. The CTM has a responsibility to ensure the assessment process is accessible and understandable, not burdensome. A further incorrect approach that focuses exclusively on the client's stated musical preferences without exploring their emotional or physical responses to music neglects a critical component of therapeutic music assessment. While preferences are important, understanding how music affects the client is paramount for therapeutic efficacy. This narrow focus risks overlooking potential benefits or risks associated with specific musical elements, thereby failing to provide truly therapeutic care. The professional reasoning process for similar situations should involve a systematic evaluation of the client's presenting needs, the therapeutic goals, and the available assessment tools. Professionals should prioritize methods that are client-centered, ethically compliant, and evidence-informed. This includes building rapport, explaining the purpose and process of assessment, ensuring confidentiality, and using a combination of qualitative and quantitative techniques to gather a holistic picture of the client's situation. The decision-making framework should always prioritize client safety, well-being, and the efficacy of the therapeutic intervention. Question 14. Implementation of therapeutic music interventions for a patient with documented sensory processing sensitivities and a history of positive responses to gentle piano melodies and rhythmic percussion, but who has expressed discomfort with loud brass instruments, requires the certified therapeutic musician, CTM, to select appropriate instruments. Which of the following approaches best aligns with professional standards and patient well-being? Option A. Choose a loud brass instrument for a brief introductory period, believing that gradual exposure to a disliked sound can build tolerance. Option B. Select only piano music, as it was previously well received, and disregard the patient's potential interest in other instrument families. Option C. Propose a selection of instruments that includes the piano and various hand percussion instruments, while explicitly avoiding brass instruments, and discuss these options with the patient to gauge their comfort and preference before commencing. Option D. Introduce a new, complex orchestral percussion piece on a large drum, assuming the rhythmic element will be beneficial, despite the patient's known sensitivities to loud sounds. The correct answer is C. Propose a selection of instruments that includes the piano and various hand percussion instruments, while explicitly avoiding brass instruments, and discuss these options with the patient to gauge their comfort and preference before commencing. Explanation. The scenario presents a challenge for a certified therapeutic musician, CTM, tasked with selecting appropriate instruments for a patient with specific sensory sensitivities and a history of positive engagement with certain instrument types. The professional challenge lies in balancing the patient's expressed preferences and sensitivities with the CTM's professional judgment regarding the therapeutic efficacy and safety of instrument selection. This requires a nuanced understanding of how different instrumental timbres, volumes, and playing techniques can impact a patient's emotional and physiological state, especially when sensory processing differences are involved. Careful judgment is required to avoid triggering distress while maximizing therapeutic benefit. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to ethical guidelines that mandate informed consent and respect for patient autonomy. By actively involving the patient in the selection process, acknowledging their stated sensitivities, and proposing instruments that align with their positive past experiences, the CTM demonstrates a commitment to individualizing therapeutic interventions. This aligns with the core principles of therapeutic musicianship, which emphasize creating a safe and supportive environment conducive to healing and well-being. The regulatory framework for CTMs, while not explicitly detailed here, would implicitly support such a patient-centered, evidence-informed, and ethically sound approach. An incorrect approach that focuses solely on the CTM's personal preference for a particular instrument, disregarding the patient's stated sensitivities, represents a significant ethical failure. This approach violates the principle of patient autonomy and could lead to iatrogenic harm by triggering sensory overload or distress, negating any potential therapeutic benefit. It also demonstrates a lack of professional competence in adapting interventions to individual needs. Another incorrect approach that involves introducing a new, potentially overwhelming instrument without prior discussion or gradual introduction, despite the patient's known sensitivities, is also professionally unacceptable. This demonstrates a failure to adequately assess risk and a disregard for the patient's comfort and safety. Ethically, it breaches the duty of care by potentially causing harm. A further incorrect approach that relies on a generalized assumption about instrument suitability for a condition without considering the specific patient's history and expressed preferences is also flawed. Therapeutic musicianship requires individualized assessment and intervention, not a one-size-fits-all methodology. This approach risks misapplication of therapeutic techniques and overlooks the unique needs of the individual. The professional decision-making process for similar situations should involve a thorough initial assessment of the patient's needs, preferences, and any contraindications. This should be followed by collaborative goal setting and intervention planning, where the patient is an active participant. The CTM should then select interventions based on their professional knowledge, ethical guidelines, and the patient's specific context, always prioritizing safety and efficacy. Ongoing assessment and adaptation of the intervention based on the patient's response are crucial components of effective therapeutic practice. Question 15. Stakeholder feedback indicates that some certified therapeutic musicians, CTM, are encountering clients who express a strong desire to engage in guided imagery and music, GIM sessions focused on specific, potentially intense, personal narratives or past experiences. In such situations, how should a CTM ethically and effectively approach the GIM session to ensure client safety and therapeutic benefit, while respecting the client's expressed wishes and the CTM scope of practice? Option A. Gently steer the client away from their specific narrative focus towards more general themes of relaxation and well-being, explaining that GIM is primarily intended for stress reduction and that delving into specific past experiences can be unpredictable. Option B. Immediately implement the client's requested GIM sequence, trusting their intuition and desire for a specific experience, and provide supportive music and minimal guidance to allow the client to lead the imagery exploration without interruption. Option C. Initiate a detailed discussion with the client to explore their motivations and expectations for the GIM session. Assess their current emotional readiness and understanding of the GIM process, and collaboratively design a GIM experience that aligns with their goals and comfort level, ensuring the music and imagery are appropriate and supportive. Option D. Proceed with a pre-selected, advanced GIM protocol that is known to facilitate deep emotional processing, assuming the client's request indicates a readiness for such an intense experience, and focus on guiding them through the music's narrative. The correct answer is C. Initiate a detailed discussion with the client to explore their motivations and expectations for the GIM session. Assess their current emotional readiness and understanding of the GIM process, and collaboratively design a GIM experience that aligns with their goals and comfort level, ensuring the music and imagery are appropriate and supportive. Explanation. This scenario presents a professional challenge because it requires a certified therapeutic musician, CTM, to navigate the ethical and regulatory boundaries of guided imagery and music, GIM, techniques within the context of client autonomy and potential therapeutic transference. The CTM must balance the client's expressed desire for a specific GIM experience with the professional responsibility to ensure the client's well-being and to maintain appropriate therapeutic boundaries, all while adhering to the CTM scope of practice as defined by the relevant regulatory framework. Careful judgment is required to avoid imposing personal interpretations or pushing the client beyond their comfort zone, which could be detrimental. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered GIM experience. By engaging in open dialogue, assessing the client's readiness and understanding, and tailoring the GIM session to their specific needs and stated goals, the CTM demonstrates adherence to ethical principles of informed consent and beneficence. This approach aligns with regulatory guidelines that emphasize client autonomy and the importance of a therapeutic relationship built on trust and respect. The CTM's role is to facilitate the client's internal journey, not to direct it, ensuring the GIM experience remains a safe and effective therapeutic tool. An incorrect approach that involves proceeding with a complex GIM sequence without fully assessing the client's current emotional state or understanding of the process would represent a significant regulatory and ethical failure. This could lead to client distress, re-traumatization, or a sense of being overwhelmed, violating the principle of non-maleficence. Another incorrect approach, such as dismissing the client's stated preferences for imagery and imposing a predetermined GIM script, would violate the principle of autonomy and could damage the therapeutic alliance, potentially contravening guidelines on client-centered care. Furthermore, failing to document the client's consent and the rationale for the chosen GIM approach could be a breach of record-keeping regulations. Professionals should employ a decision-making framework that begins with active listening and thorough client assessment. This involves understanding the client's goals, their experience with GIM, and their current emotional and psychological state. The next step is to educate the client about the GIM process, including potential experiences and the therapist's role. Following this, a collaborative decision should be made regarding the specific GIM techniques and music selections, ensuring the client feels empowered and safe. Ongoing assessment throughout the session is crucial, with flexibility to adapt the GIM experience based on the client's responses. Finally, thorough documentation of the process and outcomes is essential for professional accountability and continuity of care. Question 16. Process analysis reveals that the historical context of therapeutic music interventions has evolved significantly, from early anecdotal observations to a more formalized, evidence-based profession. When considering the implementation of therapeutic music practices, how should a certified therapeutic musician, CTM, best integrate this historical evolution into their current professional practice, ensuring adherence to the regulatory framework governing CTMs in this jurisdiction? Option A. Disregard historical research and development in therapeutic music, focusing solely on contemporary techniques without acknowledging the foundational evolution of the field. Option B. Emphasize historical accounts of music's perceived healing properties, regardless of current scientific validation or regulatory approval for therapeutic use. Option C. Focus on the historical, artistic, and expressive elements of music, applying them in therapeutic settings without necessarily linking them to specific health outcomes or regulatory guidelines. Option D. Prioritize the integration of historical methodologies that demonstrate a clear lineage to current evidence-based music therapy practices and align with the established scope of practice for CTMs. The correct answer is D. Prioritize the integration of historical methodologies that demonstrate a clear lineage to current evidence-based music therapy practices and align with the established scope of practice for CTMs. Explanation. This scenario presents a professional challenge because it requires a certified therapeutic musician, CTM, to navigate the historical evolution of their practice while adhering to current regulatory frameworks. The challenge lies in discerning which historical influences are still relevant and ethically permissible within the contemporary CTM scope of practice, as defined by the specific regulatory body governing CTMs in this jurisdiction. A CTM must demonstrate an understanding of how the field has developed without adopting outdated or unproven methodologies that may not align with current evidence-based practices or ethical guidelines. The correct approach represents best professional practice because it demonstrates a commitment to evidence-based practice and adherence to the current regulatory framework for CTMs. By focusing on the historical development of music therapy as a recognized profession and its integration into healthcare settings, this approach acknowledges the foundational principles while prioritizing contemporary, regulated applications. This aligns with the ethical imperative to provide services that are safe, effective, and within the established scope of practice, as mandated by the governing body for CTMs. An incorrect approach that relies solely on anecdotal historical accounts without considering current evidence or regulatory oversight fails to meet professional standards. Such an approach risks employing techniques that are not validated, potentially leading to ineffective or even harmful interventions, which would be a direct violation of ethical codes and regulatory requirements for CTMs. Another incorrect approach that prioritizes historical artistic expression over therapeutic outcomes ignores the fundamental purpose of therapeutic music interventions as defined by the CTM certification. This deviates from the professional obligation to use music for specific health and well-being goals, as outlined in the regulatory framework. Finally, an approach that dismisses the impact of historical research on modern practice overlooks the continuous refinement and evidence gathering that underpins the legitimacy and efficacy of therapeutic music services, a core tenet of professional development and regulatory compliance for CTMs. The professional decision-making process for similar situations involves a critical evaluation of historical information through the lens of current evidence-based practice and the specific regulatory and ethical guidelines governing the CTM profession. Professionals must ask, does this historical practice align with current scientific understanding of music's therapeutic effects? Is it supported by contemporary research? Does it fall within the defined scope of practice for a CTM in this jurisdiction? Does it adhere to the ethical principles and standards set forth by the certifying body? This critical filtering ensures that practice remains grounded in both historical context and contemporary professional responsibility. Question 17. Compliance review shows a certified therapeutic musician, CTM, is developing an intervention plan for a patient experiencing chronic neuropathic pain. The CTM is considering various applications of music to address the patient's pain. Which of the following approaches demonstrates the most comprehensive and evidence-based understanding of music's role in pain management, considering both physiological and psychological mechanisms? Option A. Utilizing a playlist of classical music known for its calming effects, assuming that passive listening will naturally decrease pain perception through general distraction. Option B. Suggesting the patient experiment with various genres of music to find what they subjectively find most distracting, without considering the underlying mechanisms of pain modulation. Option C. Implementing a structured protocol of guided imagery combined with music designed to evoke relaxation and reduce sympathetic nervous system arousal, alongside active music-making exercises aimed at improving motor control and reducing muscle tension associated with the pain. Option D. Recommending the patient listen to their favorite upbeat music for at least 2 hours daily, believing that positive emotional states alone are sufficient to override pain signals. Correct answer is C. Implementing a structured protocol of guided imagery combined with music designed to evoke relaxation and reduce sympathetic nervous system arousal, alongside active music-making exercises aimed at improving motor control and reducing muscle tension associated with the pain. Explanation. This scenario presents a professional challenge because it requires a certified therapeutic musician, CTM, to apply their knowledge of music's impact on pain management in a real-world clinical setting, balancing patient needs with established therapeutic protocols. The CTM must discern the most appropriate application of music-based interventions, considering the underlying physiological and psychological mechanisms of pain. Careful judgment is required to select an approach that is both evidence-based and tailored to the individual patient's experience. The correct approach represents best professional practice because it aligns with the core principles of therapeutic musicianship and the established understanding of music's role in pain management. This approach prioritizes a multimodal strategy that addresses both the sensory and affective components of pain, leveraging music's known effects on the nervous system, such as the release of endorphins, modulation of the stress response, and distraction from painful stimuli. This aligns with the ethical imperative to provide patient-centered care that is informed by current best practices and scientific understanding, as outlined in the CTM's professional guidelines. An incorrect approach that focuses solely on passive listening without considering the patient's active engagement or the specific nature of their pain fails to fully utilize music's therapeutic potential. This could be a regulatory or ethical failure if it deviates from established protocols for music therapy and pain management, potentially leading to suboptimal patient outcomes. Another incorrect approach that relies on anecdotal evidence or unverified claims about music's efficacy, without grounding in scientific principles or clinical evidence, represents a failure to adhere to professional standards of practice and could be considered a breach of professional responsibility. A third incorrect approach that disregards the patient's preferences or cultural background in selecting music, even if theoretically sound, overlooks the crucial element of patient rapport and engagement, which is fundamental to effective therapeutic intervention. This can lead to a breakdown in the therapeutic relationship and hinder the effectiveness of the intervention, potentially violating ethical guidelines regarding patient autonomy and respect. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's pain experience, including its intensity, duration, location, and impact on their quality of life. This assessment should be followed by a review of evidence-based music interventions for pain management, considering the specific physiological and psychological mechanisms at play. The CTM should then select and adapt interventions based on the patient's individual needs, preferences, and clinical context, continuously evaluating the effectiveness of the intervention and making adjustments as necessary. This iterative process ensures that the therapeutic approach remains aligned with best practices and patient well-being. Question 18. Investigation of the most effective method for a certified therapeutic musician, CTM, to assess and document the impact of a therapeutic music session on a client's reported anxiety levels and observable signs of relaxation. Option A. Combining client self-reported anxiety scores, e.g., on a 1-10 scale, before and after the session, with observational notes on physical indicators of relaxation such as decreased muscle tension, slower breathing rate, and a more settled demeanor. Option B. Focusing solely on objective physiological measurements like heart rate variability, without correlating it with the client's subjective experience or observable behaviors. Option C. Relying exclusively on the musician's subjective feeling of whether the client appeared more relaxed after the session. Option D. Documenting only the client's verbal feedback about how the music made them feel, without any structured scoring or observation. The correct answer is A. Combining client self-reported anxiety scores, e.g., on a 1-10 scale, before and after the session with observational notes on physical indicators of relaxation such as decreased muscle tension, slower breathing rate, and a more settled demeanor. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing the impact of therapeutic music interventions. While the musician aims to document positive changes, the absence of standardized, quantifiable metrics for emotional and physiological responses can lead to biased or incomplete evaluations. The Certified Therapeutic Musician, CTM, designation implies adherence to a specific ethical and professional code, likely emphasizing evidence-based practice and client-centered care. Careful judgment is required to balance anecdotal observations with a structured, objective approach to evaluation. The correct approach represents best professional practice because it integrates multiple data points, including client self-report and observable behavioral changes, within a structured framework. This multifaceted evaluation, when documented consistently, provides a more comprehensive picture of the intervention's impact. It aligns with ethical guidelines that mandate thorough assessment and client involvement in the therapeutic process. Furthermore, it supports the development of individualized care plans and demonstrates accountability for the effectiveness of the therapeutic music. An incorrect approach that relies solely on the musician's subjective interpretation fails to meet professional standards. It risks confirmation bias, where the musician may unconsciously seek or interpret data that supports their pre-existing beliefs about the intervention's success, rather than objectively reflecting the client's actual experience. This can lead to inaccurate reporting and potentially inappropriate adjustments to the therapeutic plan, violating the ethical obligation to provide competent and evidence-informed care. Another incorrect approach that focuses only on physiological markers without considering the client's subjective experience or behavioral changes provides an incomplete picture. While physiological data can be valuable, therapeutic music's impact is often deeply intertwined with emotional and psychological states, which cannot be fully captured by physical measurements alone. This approach neglects the holistic nature of therapeutic music and may miss crucial aspects of client progress, potentially leading to a mischaracterization of the intervention's effectiveness. A further incorrect approach that prioritizes anecdotal feedback without any structured documentation or systematic observation is also professionally deficient. While client testimonials are important, they are often subjective and can be influenced by various factors unrelated to the therapeutic music. Without a systematic method for collecting and analyzing this feedback, it becomes difficult to discern genuine therapeutic impact from other influences, undermining the credibility and rigor of the evaluation process. A professional decision-making process for similar situations should involve establishing clear, measurable goals for each client at the outset of the therapeutic relationship. This should be followed by the selection of appropriate assessment tools, which may include standardized questionnaires, behavioral observation checklists, and structured client interviews. Regular review and documentation of these assessments are crucial for tracking progress, informing ongoing treatment, and ensuring ethical accountability. Professionals should continuously seek to refine their evaluation methods to enhance the objectivity and validity of their findings. Question 19. What factors determine the optimal application of vocal techniques, specifically breath control, tone, and projection, when a certified therapeutic musician, CTM, is providing services to a diverse patient population with varying physiological and psychological states? Option A. The CTM's personal vocal training and preference for specific vocal styles, regardless of patient feedback. Option B. The perceived acoustic properties of the treatment environment and the need to overcome ambient noise. Option C. The individual patient's physiological and psychological state, their immediate responses to the music, and the therapeutic goals for the session. Option D. The CTM's desire to showcase advanced vocal techniques learned during their certification. The correct answer is C. The individual patient's physiological and psychological state, their immediate responses to the music, and the therapeutic goals for the session. Explanation. The scenario of a certified therapeutic musician, CTM, needing to adapt vocal techniques for diverse patient populations presents a significant professional challenge. This challenge stems from the need to balance therapeutic efficacy with patient comfort and safety, all while adhering to the strict ethical and regulatory guidelines governing therapeutic music practice. The CTM must possess a nuanced understanding of how breath control, tone, and projection directly impact a patient's physiological and psychological state, ensuring the music is supportive rather than disruptive. Careful judgment is required to select techniques that are appropriate for varying levels of patient acuity, cognitive function, and sensory sensitivities. The correct approach, which emphasizes tailoring vocal delivery to the specific needs and responses of each individual patient, represents best professional practice. This aligns with the core ethical principles of patient-centered care and beneficence inherent in the CTM's role. By actively observing and responding to patient cues, the CTM demonstrates a commitment to providing safe and effective therapeutic interventions. This individualized approach ensures that breath control supports relaxation or gentle stimulation as needed. Tone is modulated for comfort and resonance, and projection is adjusted to avoid overstimulation or distress, thereby maximizing the therapeutic benefit within the established regulatory framework for therapeutic musicians. Incorrect approaches fail to meet these professional standards and may lead to ethical or regulatory breaches. Focusing solely on technical perfection without regard for patient response disregards the therapeutic intent and can be detrimental. For instance, prioritizing powerful projection in a patient experiencing anxiety or pain would be a direct violation of the principle of non-maleficence, potentially exacerbating their distress and contravening guidelines that mandate patient comfort and safety. Similarly, neglecting breath control to maintain a specific vocal quality, such as a continuous vibrato, when a patient requires stillness or quiet, demonstrates a lack of clinical awareness and adherence to patient-centered care. An approach that relies on a standardized vocal delivery for all patients, irrespective of their condition or environment, is ethically unsound as it fails to provide individualized care and could lead to unintended negative therapeutic outcomes, potentially falling outside the scope of approved therapeutic practices. Professional decision-making in such situations requires a systematic process. The CTM should first assess the patient's current state, including their physical condition, emotional presentation, and any known sensitivities. This assessment informs the selection of appropriate vocal techniques. Throughout the session, continuous observation of the patient's responses is crucial, allowing for real-time adjustments to breath control, tone, and projection. This iterative process of assessment, intervention, and reassessment, guided by ethical principles and regulatory requirements, ensures that the therapeutic music remains a safe and beneficial modality. Question 20. When evaluating the potential impact of music on a client's nervous system for therapeutic purposes, which approach best aligns with the ethical and professional responsibilities of a certified therapeutic musician, CTM? Option A. applying generalized theories about music's calming or stimulating effects based on genre, without specific client assessment. Option B, focusing on the direct medical manipulation of neurological pathways through specific musical frequencies, assuming a diagnostic and treatment role. Option C, integrating current scientific understanding of music's neurobiological effects with a thorough assessment of the individual client's presentation, preferences, and stated goals. Option D, prioritizing the CTM's personal musical expertise and preferred repertoire to guide intervention selection. Correct answer is C, integrating current scientific understanding of music's neurobiological effects with a thorough assessment of the individual client's presentation, preferences, and stated goals. Explanation: scenario analysis. This scenario is professionally challenging because it requires a certified therapeutic musician, CTM, to interpret and apply complex neurobiological responses to music within the context of client care, while adhering to the specific ethical and regulatory framework governing their practice. The CTM must balance the scientific understanding of music's impact on the nervous system with the individual needs and responses of each client, ensuring interventions are both effective and ethically sound. The challenge lies in translating theoretical knowledge into practical, client-centered therapeutic applications that respect client autonomy and well-being, all within the defined scope of practice for a CTM. Correct approach analysis. The correct approach emphasizes the CTM's responsibility to integrate current scientific understanding of music's neurobiological effects with a thorough assessment of the individual client's presentation, preferences, and stated goals. This aligns with the CTM's ethical obligation to provide evidence-informed and client-centered care by considering how music might influence the autonomic nervous system, e.g., promoting relaxation through parasympathetic activation or arousal through sympathetic activation, and the limbic system, affecting mood and emotional regulation. The CTM can tailor interventions to address specific therapeutic objectives, such as reducing anxiety, managing pain perception, or enhancing mood. This approach is grounded in the principle of beneficence and non-maleficence, ensuring that interventions are chosen for their potential to benefit the client and minimize harm, all while respecting the client's unique experience and consent. Incorrect approach is analysis. One incorrect approach involves solely relying on generalized assumptions about music's effects without individual client assessment. This fails to acknowledge the variability in human response to music and could lead to inappropriate or ineffective interventions, potentially causing distress or exacerbating a client's condition. Ethically, this violates the principle of individualized care and could be seen as a failure to exercise due diligence in understanding the client's specific needs. Another incorrect approach is to prioritize the CTM's personal musical preferences or theoretical knowledge over the client's expressed needs and responses. This demonstrates a lack of client-centered practice and disrespects the client's autonomy and lived experience. It also risks misinterpreting the neurobiological impact of music, as a client's subjective experience may differ significantly from generalized scientific findings. A further incorrect approach is to overstate the CTM's role in directly manipulating neurological pathways, implying a level of medical intervention beyond the scope of practice for a therapeutic musician. CTMs work with music to support well-being and facilitate therapeutic processes, but they do not diagnose or treat neurological conditions in a medical sense. This approach could lead to ethical breaches related to scope of practice, and potentially mislead clients about the nature and limitations of therapeutic music services. Professional reasoning. Professionals in this field should adopt a decision-making process that begins with a comprehensive client assessment, including their current state, therapeutic goals, and any relevant medical or psychological considerations. This assessment should be followed by a review of current, evidence-based understanding of music's neurobiological impact, specifically considering how different musical elements, tempo, melody, harmony, rhythm, might influence physiological and psychological responses. The CTM must then synthesize this information, considering the client's preferences and potential responses, to select and adapt musical interventions that are most likely to support the client's stated goals. Throughout the process, ongoing observation of the client's reactions and feedback is crucial for adjusting the intervention and ensuring its continued appropriateness and effectiveness, always within the ethical and regulatory boundaries of their practice.